Welcome to today's video where we'll be discussing a common, yet often embarrassing condition, pruritus ani, also known as anal itching. We'll delve into what causes it, how it affects the body, what the symptoms are, and most importantly, how to manage and prevent it. So, let's get started. The causes of pruritus ani are varied and often difficult to pinpoint. In many cases, it's considered idiopathic, meaning the exact cause is unknown. However, some common culprits include excessive cleaning or aggressive wiping of the anal area, which can irritate the delicate skin. Conversely, poor hygiene leading to residual fecal matter can also be a factor. Other potential causes involve certain skin conditions like eczema, psoriasis, or seborrheic dermatitis. Dietary factors such as spicy foods, coffee, alcohol, and citrus fruits can sometimes contribute. Certain medications like antibiotics can alter gut flora and increase the risk. Finally, underlying medical conditions like hemorrhoids, anal fissures, pinworm infections, and even fungal infections can trigger the itching. The pathophysiology of pruritus ani involves a complex interplay of factors. Irritation of the perianal skin leads to inflammation. This inflammation, in turn, stimulates nerve endings, triggering the sensation of itching. Scratching provides temporary relief but perpetuates the cycle. The scratching further damages the skin, leading to more inflammation and increased susceptibility to infection. This itch-scratch cycle is a key element in understanding why pruritus ani can become a chronic and persistent problem. The damaged skin barrier also allows for easier penetration of irritants and allergens, further exacerbating the condition. Pruritus ani is a relatively common condition, affecting a significant portion of the population at some point in their lives. While precise epidemiological data is limited, it is estimated to affect up to 5% of the general population. It tends to be more prevalent in adults, particularly those between the ages of 30 and 50. Men are also slightly more likely to experience pruritus ani than women. While it can affect people of all backgrounds, certain lifestyle factors, such as diet and hygiene habits, can influence its occurrence. The most prominent symptom of pruritus ani is, of course, itching around the anus. This itching can range from mild and intermittent to severe and persistent. It often intensifies at night, disrupting sleep. Other symptoms may include burning, soreness, and a feeling of rawness in the anal area. The skin around the anus may appear red, inflamed, and thicken from chronic scratching. In some cases, small cuts or fissures may be visible. If an infection is present, there may be drainage or a foul odor. Diagnosing pruritus ani typically involves a thorough physical examination and a detailed medical history. The doctor will visually inspect the anal area for signs of inflammation, skin changes, or underlying conditions like hemorrhoids or fissures. They may ask about your hygiene habits, diet, and any medications you're taking. In some cases, further investigations may be necessary. These could include a stool sample to check for parasites or infections, skin scrapings to rule out fungal infections, or a patch test to identify potential allergens. A proctoscopy or sigmoidoscopy may be performed to examine the rectum and lower colon for any abnormalities. While pruritus ani isn't typically categorized into distinct types, it can be classified based on its cause. Primary pruritus ani refers to cases where the underlying cause is unknown or related to hygiene and lifestyle factors. Secondary pruritus ani, on the other hand, is caused by an identifiable underlying medical condition, such as hemorrhoids, fissures, or infections. Identifying the specific cause is crucial for effective treatment. The treatment of pruritus ani focuses on relieving symptoms, addressing any underlying causes, and breaking the itch-scratch cycle. General measures include gentle cleansing of the anal area with warm water and mild soap after each bowel movement. Avoid harsh soaps, scented wipes, and excessive scrubbing. Pat the area dry instead of rubbing. Topical corticosteroids, such as hydrocortisone cream, can help reduce inflammation and itching, but should be used sparingly and under the guidance of a doctor. Other topical treatments, like barrier creams containing zinc oxide or calamine lotion, can provide protection and soothe the skin. If an underlying condition is identified, it needs to be treated appropriately. For example, hemorrhoids may require surgery or other interventions, while infections will need to be treated with antibiotics or antifungals. In some cases, dietary modifications, such as avoiding spicy foods, caffeine, and alcohol, may be recommended. Preventing pruritus ani involves adopting good hygiene habits and avoiding potential irritants. Practice gentle cleansing of the anal area after each bowel movement. Avoid excessive wiping and harsh soaps. Wear loose-fitting cotton underwear to promote air circulation. Avoid scratching the anal area. Address any underlying medical conditions that may contribute to itching. Be mindful of your diet and identify any foods that seem to trigger symptoms. Consider using a Bite It or sitz bath to cleanse the anal area gently. Finally, avoid using scented toilet paper or feminine hygiene products. The prognosis for Pruritus ani is generally good with appropriate treatment and management. Most cases resolve with simple measures like improved hygiene and topical creams. However, chronic Pruritus ani can be more challenging to treat and may require a more comprehensive approach. Recent research has focused on understanding the role of the gut microbiome in skin health and exploring the potential of probiotics in managing Pruritus ani. Newer topical medications with anti-inflammatory and antipruritic properties are also being developed. If symptoms persist despite self-care measures, it's essential to consult a doctor for further evaluation and treatment.